Use legal measures only to combat the virus and cooperate with government officials, first responders and healthcare workers to make the coronavirus a thing of the past and create a perfect society ASAP, as soon as possible. Use common sense, logic and help your fellow humans if necessary, also to lower the risk of being vaccinated mandatorily ourselves and to end the pandemic as soon as possible. The objective of my videos is not to slander people nor to incite or trigger people, but to do the opposite, exposing it when people are wrongly accused and to create universal peace, world peace or just peace on earth. People are innocent till proven guilty in the court of law. One who knows of evidence must testify, not to convict anyone without a fair trial. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and always get proper treatment for serious medical conditions. Greetings, superior beings, greetings, supreme being, where all the human race are common enemies, death. Welcome on Perfect Society on YouTube. You are watching the broadcast Coronavirus patients from Japan and Korea reinfected, suggesting reinfection possibility likely, ? So I'm just going to read these two articles. I haven't selected the correct picture yet. I just finished dinner. This one's on Reuters.com, April 10th, 2020. That's today. Updated an hour ago. South Korea reports recovered coronavirus patients testing positive again. And the other one is the Japan Times. And this was... what is the date on this one? February 28th, 2020. So I saw Dr. or Professor Fauci, and he was wondering about this as well. And the question is also, it is very well possible that it is an antibody, it's an antibody dependent virus in reality, SARS-CoV-2. So I've covered that in previous broadcasts already. And then how could people develop antibodies? Is that possible überhaupt when people are dealing with an antibody dependent virus? But let's first read the articles and then we can ponder upon these and other questions. People can write stuff in the chat. I'll have to go back to the live screen and then I can pop out the chats. Let's first restart the text-to-speech engine. I doubt if that would work. So then I'm going to make new source in Open Broadcaster software. My previous broadcast was about this 60 gigahertz regig box and the detrimental health effects of the 5G. New radio NR bands. But now we can read the articles, so let's do that first. Then I start with Japan Times, since that was February 28th and we're now at 10th of April 2020. Morning commuters. Okay, let's just read it. This is not too lengthy, it's not too long. Alright, here we go.
Morning commuters wearing protective masks walk through Tokyo's Shibuya district. Bloomberg national questions raised over COVID-19 reinfection after Japanese woman develops illness again by Magdalena Yosemite staff writer. February 28, 2020 article History print share. Can someone who has overcome COVID-19 develop the illness again? Technically, yes. Reports that a recovered coronavirus patient in Japan tested positive for a second time have sparked debate about the possibility. Experts note that test results suggesting recurrent infections may result from erroneous diagnoses linked to a limited testing capacity, but they also caution that there is possibility of the virus reactivating. The Osaka prefectural government said Wednesday that a woman in her 40s from Osaka tested positive for COVID-19 after what appeared to be a recovery earlier in February. According to the prefecture, the woman first tested positive on January 29 after joining a tour in which visitors from the Chinese city of Wuhan, where the virus is thought to have originated, also took part. She was discharged from the hospital on February 1 after her condition improved. The woman tested negative during a monitoring period a few days after her release, but she was still symptomatic. She tested positive again on Wednesday after multiple visits to the hospital. Related stories: Tokyo Disneyland joins long list of establishments and events hit by COVID-19. Abe's bold school closure move appears spurred by criticism of virus response. So are recurrent infections possible? Virologists and epidemiologists say it's too soon to say with regards to the new coronavirus, officially named SARS-CoV-2. But Masaya Yamato, director of the Infectious Diseases Center at the Osaka-based Rinku General Medical Center, rejects the possibility in the Osaka woman's case. I believe the virus has reactivated, Masaya said by telephone on Thursday. Such a scenario, Yamato said, is likely in patients who have not yet produced antibodies, which protect the body against the virus. In healthy people with fully developed antibodies, reactivation is rather unlikely, he said. A patient who contracts the virus needs about 14 days, or longer in some patients like the elderly, to produce the antibodies, he said. A recovery doesn't mean the virus is gone, it is dormant. He explained that like other viruses, including SARS in 2003, SARS-CoV-2 remains latent in certain cells in the body, for instance, in gastrointestinal tissues. Once reactivated, the virus may again attack the respiratory tract and intestines, he added. Experts say the body's immune response determines whether coronavirus patients believed to have overcome the disease later develop serious illnesses. Earlier this month, Tatoshi Oshitani, a professor of virology at the Tohoku University Graduate School of Medicine, said coronavirus reinfections are possible but that they would likely be less severe. Mark Windisch, head of the Applied Molecular Virology Lab at the Institute Pasteur Korea, who made clear he was speaking in a personal capacity, agrees. He said that reinfections are usually either asymptomatic or accompanied by only mild symptoms because adaptive immune systems immediately take on the pathogen. He said, however, that COVID-19 can be fatal in immunodeficient patients, transplant patients or those infected with HIV, because the adaptive immune system is missing. Experts also point to vague criteria allowing doctors to discharge patients who have not overcome the disease and suggest that test results may be misleading. An official from the Osaka Prefectural Government's medical section said the woman who tested positive after a recovery was released before the government issued guidelines for medical institutions treating coronavirus patients. Before February 3, the government had not required doctors to perform polymerase chain reaction, PCR, tests when discharging patients. Doctors could decide to release patients if their temperatures hadn't gone higher than 37.5 degrees Celsius during a 24-hour period, their symptoms showing respiratory infection had shown improvement and blood cell analysis had shown signs of recovery. The Health Ministry later in February asked all medical institutions accepting COVID-19 patients to conduct PCR tests until 2 negative tests were recorded. My question would be, why do they keep testing? David Fisman, a professor of epidemiology at the University of Toronto, asked rhetorically in an email to the Japan Times. He said he would regard a positive result after a negative as a false positive likely due to persistent viral material, but Yamato, of the Infectious Diseases Center, stressed that without a blood antibody screening, tests of saliva or sputum collected from the patient's throat won't be sufficient to detect the virus. Conducting all possible tests for viral infection would be unrealistic, he said. Contributing writer Enzo De Gregorio assisted with this report.
Okay. Good japantimes.co.jp article. I think it all makes sense, I guess. And one thing is, of course, the question how reliable the tests are. I did a broadcast about it recently. I heard another person about these tests, a really strange story, and perhaps people should refuse the test unless it's known how reliable the test results are, if there are not too many false positives, etc., to push chemical against causing prescription drugs upon the people to reduce the global population or whatever. There are so many people busy with that. So how can anybody not wonder about these things, I wonder. And I wrote down some questions for doctors and other people out there. And people can always Skype Prologic 999 if they'd like to make a broadcast. And I'll pre-record it, and if it's not in violation of the YouTube user policy, then I'll upload it to my channel.
Coronavirus questions. Could it be an antibody-dependent virus? Is there any evidence that proves it is not a bioweapon? Could it be a race-specific bioweapon? How reliable are the test kits? Were all coronavirus patients vaccinated? Did the patients all eat fish, pork or other types of meat? How zoonotic is the SARS-CoV-2 virus? At what temperature does the virus die? Can a fever kill the virus? Should antipyretic, fever-suppressing drugs be avoided? Can it mutate into a deadlier and more virulent, contagious virus? Is it mutating into a less viral but deadlier virus now? Is CVD a nosocomial disease? If SARS-CoV-2 is antibody-dependent, can patients produce antibodies that can destroy the virus? Does pasteurization kill the virus with 100% certainty, and at what temperature? "33 of the 585 environmental samples collected from the Wuhan Henan seafood wholesale market were found to contain the nucleic acid of the novel coronavirus, according to Reinfection.
Next article produced today, and perhaps they cannot say it with certainty yet. And perhaps no one knows if it's an antibody-dependent virus. If they haven't tested it, how could they possibly know?
World News, April 10, 2020, 1:25 p.m. Updated an hour ago. South Korea reports recovered coronavirus patients testing positive again. Josh Smith, Sang My Cha 3 minutes read, Seoul, Reuters, South Korean.
So the question is, when it's known that children are not dying from the virus, only a very low amount of children die from it, it's mostly the elderly that die from the virus, then the question is, does that rule out that it's an antibody-dependent virus? I don't think so. If it also contains HIV, can anybody rule out that it escaped from a lab, or that it was designed by, for example, Peer Bright or some other company that hasn't patented it and just put it out there and already has the virus waiting to be patented for SARS-CoV-2? I mean, they have other coronavirus that are coronavirus coronavirus or coronaviruses that are patented. And I've covered that in previous broadcasts. Let's see if I can stretch this better. Like this. Yep. Okay. So let's continue reading Reuters.com.
Officials on Friday reported 91 patients thought cleared of the new coronavirus had tested positive again. Jing Kai-Eong, director
Korean officials reported on Friday. South Korean officials reported on Friday that at least 91 patients thought cleared of the new coronavirus had tested positive again. Korea's Center for Disease Control and Prevention have said that the virus may have been reactivated, rather than the patients being reinfected. On Friday that at least 91 patients thought cleared of the new coronavirus had tested positive again. Korea's Center for Disease Control and Prevention have said that the virus may have been reactivated, rather than the patients being reinfected. But authorities say it remains unclear what is behind the trend, and that investigations are still underway. Some experts have suggested that false test results could also be at fault, but may not be infectious or of danger to the host or others. But the prospect of people being reinfected with the virus is of international concern. Many countries are hoping and relying on infected populations developing sufficient immunity to prevent a resurgence of the virus. South Korea on Friday reported its lowest number of new infections after daily cases peaked at more than 900 in late February, and the death toll rose to at least 211.
You run a business. You already know just how many jobs come
of the Korea Centers for Disease Control and Prevention, KCDC, told a briefing that the virus may have been reactivated rather than the patients being reinfected. South Korean health officials said it remains unclear what is behind the trend, with epidemiological investigations still underway. Advertisement. The prospect of people being reinfected with the virus is of international concern, as many countries are hoping that infected populations will develop sufficient immunity to prevent a resurgence of the pandemic. The South Korean figure had risen from 51 such cases on Monday. Nearly 7,000 South Koreans have been reported as recovered from COVID-19, the disease caused by the new coronavirus. A woman dons plastic gloves to prevent contracting the coronavirus ahead of casting her ballot at a polling station in Seoul, South Korea, April 10, 2020. Reuters, the number will only increase. 91 is just the beginning now, said Kim Woo-ju, professor of infectious diseases at Korea University Guro Hospital. The KCDC's Jang raised the possibility that rather than patients being reinfected, the virus may have been reactivated. Kim also said patients had likely relapsed rather than been reinfected. False test results could also be at fault, other experts said, or remnants of the virus could still be in patients' systems but not be infectious or of danger to the host or others. Advertisement. There are different interpretations and many variables, said Young Ki-sok, professor of pulmonary medicine at Harlem University Sacred Heart Hospital. The government needs to come up with responses for each of these variables. South Korea on Friday reported 27 new cases, its lowest after daily cases peaked at more than 900 in late February, according to KCDC, adding the total stood at 10,450 cases. The death toll rose by 7 to 211, it said. A woman wearing a preventive face mask has her temperature checked, as a safety measure to prevent the further spread of the coronavirus, before casting a ballot for parliamentary elections at a polling station in Seoul, South Korea, April 10, 2020. Reuters, ran the city of Daegu, which endured the first large coronavirus outbreak outside of China, reported 0 new cases for the first time since late February. With at least 6,807 confirmed cases, Daegu accounts for more than half of all South Korea's total infections. The spread of infections at a church in Daegu drove a spike in cases in South Korea beginning in late February. The outbreak initially pushed the tally of confirmed cases much higher than anywhere else outside of China, before the country used widespread testing and social distancing measures to bring the numbers down. Reporting by Josh Smith and Sang Mai Cha, editing by Michael Perry and Jason Neely. Our Standards, the Thomson Reuters Trust Principles.
Again, an excellent article. I liked how it skipped these commercials, that it's not read out by the text-to-speech engine. Nice for the blind people that use the text-to-speech engine as well. So that was the Reuters.com article. So one is South Korea reports recovered coronavirus patients testing positive again. And the other one, questions raised over COVID-19 reinfection after Japanese woman develops illness again. What can I say about it? Well, as people know from previous broadcasts, I use colloidal silver regularly. We can say it is a cure. The FDA won't allow that. I've explained it also, why some people consider the FDA criminal for that reason. And that has to do with the expensive tests that people would have to do. Though there are already independent scientific tests that have proven that colloidal silver kills SARS coronavirus. SARS coronavirus is destroyed by colloidal silver is better because viruses are not living organisms according to Google, if you Google it. So people who claim that it's not effective or unsafe do not have any scientific data, no peer-reviewed scientific documents that prove this, and I've also shown the mechanism of action of colloidal silver, how colloidal silver kills these viruses by destroying the cell wall of the virus and destroying the RNA. And if it's not destroyed, then it starts copying itself into the cells, etc. Viral replication videos are on YouTube as well, so it's good to learn something about it, because there are many viruses that are causing many people problems. So then if we understand the virus better, then we all might come up with better ideas about destroying the virus to save the maximum number of human lives, which is also the government's job, to protect and serve the citizens. So there are 400,064, almost 465,000 deaths caused by HIV/AIDS this year. 465,000, and then with that in mind we can check the coronavirus. And there are 102,000 coronavirus deaths. So today it went over the 100,000 line, basically, I think. And we can see that on worldometers.info, and that uses the official numbers provided by WHO and CDC. More about their unsafety standards in relation to the cancer cell phone radiation in my previous broadcast, WHO and ICNIRP. And I theorize about the possibility that there is correlation between the virus and the COVID-19 outbreak, namely that it could have to do with the natural frequency. Everything is a natural frequency, including bridges. So have they disproven that one of these bands of 5G is a natural frequency of the virus, or that it caused a mutation perhaps, which I think is more unlikely. And the other point was that the cancer cell phone radiation does affect people's immune system, and people that claim it isn't so don't have scientific data to back it up. So I have shown these peer-reviewed scientific articles that prove, and it's proven beyond any reasonable doubt, that microwaves are detrimental to human health, They cause lumping red blood cells, chromosomal damage, and DNA breaks, and a whole range of other detrimental diseases and damage to, for example, cells, cell death, apoptosis, and that's proven beyond any reasonable doubt. But I think that many people are moved by wishful thinking, the normalcy bias, wishful thinking also in the case of the people hoping that it cannot, that reinfection cannot occur, and that all these chemical cancer causing prescription drugs will be effective. And it's logical, they want to survive, so they try to aim for that, and one way is thinking about ways to survive, possible survival routes that the organism can take. And our brains are also formed by evolution, and so this was the broadcast about the possibility of reinfection. I've already made clear that if people have serious symptoms, for example a severe fever that doesn't go away, they have to contact healthcare providers and get proper treatments. So I'm not in on reducing the global population. As a matter of fact, I've exposed their population reduction plans, and well, I can think about, does this prove anything, these articles? Well, if the test is not reliable, then it doesn't prove that the patients, because there are not many, these are 2 articles that I found about it pretty fast, but I have not run into these articles before that claim that people are reinfected. So that is quite shocking and a bummer for many people that had hoped that they can build up resistance and then it can never come back, like measles or whatever. But perhaps with most viruses that's not the case. I'm not a doctor, professor, so I don't know these things. I'm just theorizing here. And I already made clear in my disclaimer that people have to follow the safety procedures and the doctor's prescription and keep their distance and follow all the cleaning procedures, washing hands, etc. Also if they use colloidal silver, and that is also because it's legally required. But how certain are they that the colloid kills the virus? Even if that's scientifically proven, how much would people have to take of it? It can depend on the strength of the product, and perhaps also on whether it's nano silver or ionic silver. I've already covered the silveredge.com and purecolloids.co.uk and the article wanttoknow.nl, which has a nice graphic of how colloidal silver destroys the virus. And UCLA also tested it and killed every virus they tested. So not just one-celled organisms and bacteria are killed by the silver, but because bacteria are also killed and our gut needs these bacteria to digest food properly, people have to replace these bacteria with a what is called probiotics, and yogurt may also contain some, but it's better to buy some probiotics, and some people use that without using colloidal silver just because it's good for them to have replenished the good bacteria in their gut, so that their gut keeps functioning properly. And people with stomach problems may have benefit from probiotics. Again, they can, if they have any type of ailments, they can contact their healthcare provider. And I'm not a doctor, so I do not assume responsibility for anything people decide for themselves. And well, we see here most cases in the USA, China 81,000. So that means the US has about more than 5 times the amount of confirmed cases. US has 5 times more cases at least than China. And that's weird because China has 1.4 billion people, the US only about 327 million people. So you would expect the numbers to be the other way around. China would have 5 times more or something like that. So how is that possible, I wonder? And people can always Skype me, Prologic 999. After this broadcast is finished, I'll put all the links in the description. And I'm now popping out the chat, so then I have to visit my live dashboard, whatever. Misclicked. Alright. Resident Evil 7. Game, probably. Somebody asked a question in Dutch. So I'll answer the question in Dutch. CC, I can pop out the chat and I can show what the person wrote. Thank you for your question. And I will answer it. Okay. The chat. CC wrote, mag ik vragen wat ik moet doen? Ik heb een slimme meter gekregen, verplicht. Wat is jouw mening hierover? Leander gebeld om te vragen of ik de oude meter terug mag. Mag niet. Ik heb hier een uitzending over gedaan. So the person is asking about a so-called smart, I call it smart cancer meter. En mensen mogen die volgens mij wel teruggeven. En als ze hem dan weer terug willen, dan moeten ze €70 betalen. Maar mensen kunnen sowieso aluminiumfolie op de meter doen. En dat is te meten met een redelijk betaalbare stralingsmeter die tot 2,5 gigahertz meet. Op eBay zijn ze zo'n €125. En het is het best om er een te hebben die een microwatt per vierkante meter meet. So my answer is people can measure it, they can put foil on the so-called smart meter. They put smart in front of everything that helps with their population reduction, everything wireless. And the negative effects of cancer cell phone radiation are proven. And I became electrosensitive probably because I lived in Amsterdam between these antennas, and I was also attacked with directed energy weapons. And that may have also caused me the ability to work. I have 2 non-contagious blood diseases, so I'm 80% disabled. I'm an audio engineer with a diploma, and I studied at the University of Amsterdam for a while, etc. So all these years of work are down the drain because I cannot work because of my disability. So yeah, good question, and I did a video about it, and I think that you may refuse it and you may ask them to take it away again, but if you can use enough aluminum foil, then you can also make use of the cheap energy. And if you don't get a smart meter but another one, then you cannot use the cheap energy. And if you can block the radiation anyway with aluminum foil, and I think that's possible, you can use several layers of foil and completely block it out, then you can still have cheap energy. I don't know, I've seen several videos of people blocking the smart meter radiation with foil, and it works well. People can measure it. Meten is weten in Dutch. So I advise people also to shield against 5G. There was shielding paint, shielding materials, shielding clothing, but especially aluminum foil on the side where the 5G antenna is placed in your city. In Meidrecht, that's the Tango usually near the 3 and 4G cancer UMTS and cancer GMS antenna masts. And I've chosen not to get the smart meter, to refuse the smart meter. Perhaps I've explained it in my video why, but just because I think it's wrong to have it in my house, and I wasn't certain if I could completely block the radiation with aluminium foil. And it's also sort of to in the hope that they one day roll it back and start using radiant energy of Nikola Tesla and healing frequencies instead of sickening frequencies that may have been chosen to reduce the global population. So everything is its own natural frequency, and some frequencies are good for us, others are bad, and they're natural electromagnetic fields as well. I need some tea. So there are healing, curing electromagnetic fields, because we are natural beings and we're electronic beings, and everything has its own natural frequency. And Dr. Rife came up with the mortal oscillatory rate frequency. So that means every virus also has its own natural frequency, a mortal oscillatory rate frequency, meaning a frequency that kills or destroys the virus, organism, or object. Like bridges also have a natural frequency, and they have to calculate it first. So yeah, let's see what others wrote. Just a Bloody Foreigner wrote Dutch Internet Junkie, en a Pumpkin and Telescope. CC, dankjewel. Zo blij dat ik jouw kanaal gevonden heb. Nou, leuk. Goed bestuderen alles, want ik denk dat het wel hele schadelijke effecten... Ik weet zeker dat 5G zeer schadelijke effecten heeft voor de volksgezondheid en een bedreiging is. En Baudet is misschien ook bezig om ervoor te zorgen dat het uit wordt gezet totdat ze hebben vastgesteld dat het geen schade voor de volksgezondheid oplevert. En ik denk dat ze dat niet kunnen vaststellen. Dus ik hoop dat hij dat erdoor krijgt en dat getest wordt door de overheid. Ook de effectiviteit en veiligheid van colloidal zilver. Just a bloody foreigner, Dutch boat shoes should help you fight COVID. Cici, kijk je ook David Icke? Let's show the chat. Well, today I've watched some David Icke. That's the question, did I watch David Icke? I admit it. I haven't watched David Icke in a very long time. And, well, he may have said some interesting things, but I think it's not about these main points, these 2 points that I've covered in relation to the correlation between 5G and the virus. And that controlled opposition would claim that there is no virus, though obviously if they can see that under the microscope, then it's not a fictional thing, it's a real virus. And we cannot assume anything. Our lives are the most important thing. Our life is the most important thing. Second, real love. Third, the real law. They say his interview has been banned. Wow, I have to be fast. Snooze one day. Okay, it's Aeolia Angel Love. But I turned it off very fast, so I use it as an alarm, tuned at 528 Hertz. The best new age piece ever created, I think, Devotion by Aeolia, and I saw him live in the Concertgebouw in Amsterdam. Very cool. Nice. Healing. new age music. And I'm not a Luciferian, I don't believe in anything. Knowing is smart, believing is stupid, I always say. He mentions 5G, correct. Just a minute ago I felt some pain in my heart. I don't know if they do that with directed energy weapons to prevent us from talking about this, and also they might, at least what they did to me I think, is when I put up foil then they start attacking me with scalar weapons. And perhaps it's, I don't know if they do that to others, but many people are really electrosensitive. And it goes hand in hand with chemical sensitivity. And the other thing, I don't see anybody writing message retracted. I didn't retract your message, it's done automatically perhaps. They don't talk about the cancer chemtrails, Project Cloverleaf. Though it is clear they have not been cancer chemtrailing for about a week, and for about a week we've had blue sky. And that may fit in with Al Gore's carbon tax scam, paid for by George Soros, the global warming hoax. So this way, yeah, you get hotter temperatures, sure, it's practically certain, though perhaps it doesn't have as much influence as they think, because it is very possible that the chemtrails trap the heat between the Earth and the cloud-seeded clouds, so it cannot dissipate into space. And secondly, the cancer-causing barium in those clouds keep the water up there, so it takes longer before it starts raining, though you have clouds all the time. So that's not what people want. I like sunshine, and also UVB may kill the virus, or destroy the virus. I still have to get used to it, that it's not a living thing according to the Google search. I could also check that further in this broadcast, but first I want to see the country with most new deaths. Looks like it's US with 1,640 deaths today. That's tough, but hopefully it will peak like they said, but I have my doubts about that. We've heard what Bill Gates said about reducing global population with 10 to 15% using vaccines, healthcare, and reproductive health services. And 10 to 15%, that's still over 1 billion people. And in Dutch it's miljoen, miljard, billion. And in America it's I have to think here. Million, billion, trillion. So not million, trillion, gazillion. Anyway, France 987 new deaths, UK 980 new deaths, Italy 570, Spain, Belgium, Iran, Netherlands in the 2, 4, 6, 8th place. So we're in the top 10 of countries with most deaths. And then I can show again where they rolled out 5G. But I did that in previous broadcasts, and I'm actually looking, or perhaps I should look for a new map. Doesn't the Dutch Antenna Bureau have a better map? I've shown it in previous broadcasts already as well. This is the antenna in Meidrecht, photographed with a Lumix G7. This is the burning antenna in Birmingham. Birmingham, I think. And I'm waiting for my virtual DJ to start. Alright, with the proper sample.
5G burning. 5G getting burnt down.
I don't know why they even burned there.
"5G burning, man. 5G burning, bro. Raving."
So many people thought that they were lit, and now there are other reports. So I'm basically, perhaps I'll do that in the next broadcast, I can make a collection of these antennas being burned down worldwide. But then the question arises, is this really done by people, or is it a malfunction? These masts are usually very high up in the air. That's one. And two is they use loads of energy, they need special cables and stuff. And they're pretty new, so we haven't had these, don't know how long they've tested them, if they're all from the same brand and stuff. But how could they prove that they were lit by someone? Well, I would think now, I haven't thought about it before to tell you the truth, but I was working on other stuff. If we see gasoline burning, that's another thing they have to watch out. If it's on a rooftop, then they have to use aluminum foil or something so that the roof doesn't burn. And of course I have to think about this, whether it's illegal to roll 5G out in the first place. There are many scientists, over 200, that have signed a petition against the rollout, that have claimed it's unsafe, and based on the scientific peer-reviewed documents, data, I agree with them basically. So I think it's illegal to roll it out in the first place. And Mr. Blumenthal in the Congress, in the US Senate or whatever it was, asked these companies if they've done any tests, any research to test if it has any negative effects on human health, and they admitted that they have done no research, they haven't spent a dime on it, zero. So I think they're crazy, and that these people don't have empathy. Perhaps there are people behind it that want to reduce the global population, that are extorting them with remote torture technology, or they're a member of some secret society, they're Masons or Bilderberg or something like that, Jesuits in control of the intelligence agencies. So perhaps Jesuits are behind this, or perhaps some rich person, so I don't know who is behind it, but I think it's not normal that they don't test the health effects before they roll out such a thing. I would assume they don't want to be in it themselves if it's harmful, detrimental to their human health, and they can do that reproducible test people can do at home, the lumping red blood cell test, but many other people did it, so you can see videos of it, and people that are exposed to the so-called smart cancer meter and cancer cell phone radiation get these lumping red blood cells, and then they say, oh yeah, well, it disappears in 3 to 4 days. But that's not true, and they're constantly exposed to the cancer cell phone radiation, I call it microwaves. So, what was the picture I wanted to show? Oh yeah, there was another one, the CV map. This one I've shown this a couple of times before, so I haven't got a more updated version of the 5G and R tests. But I have new information, because I first had that RF Global. Let's see if I can find it. RF Global. 98% of energy absorbed by O2 oxygen at 60 gigahertz. Okay, got it. The millimeter wave 5G, thumbs down, NR bands are 6 GHz, 28 GHz, 39 GHz, and 60 GHz are listed on ResearchGate. Okay, ResearchGate.net. And 5G 60 GHz, 5G 60 GHz radiation of WeGig boxes makes the hemoglobin unable to uptake the oxygen. Shortened Dana Ashley quote. And she may have based it on the information in the book. Magnetobiology. Underlying physical problems, and also smoking, so that's bad. Magnetobiology, underlying physical problems, yeah. And then RF global. This was Wiki. So I thought those are the bands of 5G, but in reality, on Wiki we can read wiki/5G_NR. 5G NR new radio is a new radio access technology, RAT, spelling red, developed by 3GPP for the 5G 5th generation mobile network. 5G NR uses two frequency ranges. Frequency range 1 FR1 including sub-6 GHz frequency bands, and frequency range 2 FR2 including frequency bands in the millimeter wave range 24 to 100 GHz. So that would also include the active denial system frequency of 95 GHz. And they use that. To burn people, to disperse crowds, etc. Okay, what else did I write down? Let's see if there are more chat remarks. Okay, I think these are alright. Oh, I didn't know his interview was banned. And I think, isn't that with 2 N's? Anyway, I've seen it today, so perhaps it's another interview. Just a bloody foreigner wrote, what you smoking, skunk or hash? Hash with much THC in it. Because THC, the active ingredient in cannabis, kills tumors by blocking vascular endothelial growth factor, a protein needed by tumors to sprout. They cannot sprout without VEGF. But the perpetrators can also make people sneeze, they can control their vocal cords, they can do all kinds of things to make people think, oh, that person is sick and is trying to tell us what to do, etc. Just a bloody foreigner. That emoji is elbow cuff. Really? Interesting. Okay. So this is the right arm. The arm that's cuffed in the elbow pit basically, so that it doesn't spread through the air, and it's caught by the clothing, which can be washed at sufficiently high temperature, and that's the best way without tissues. prevent it from spreading and contaminating our own environment, etc. We worden wakker en steeds meer mensen. Ja, dat denk ik ook. En dat is ook omdat meer mensen problemen ondervinden en dan gaan onderzoeken waar dat door kan komen. Helaas. What was the other thing I wanted to check? I'm just gonna slow down. We can check Google News for change. I haven't checked it a long time what they have in first place. Coronavirus stimulus checks. IRS releases new quote simple tax return quote to help Americans get theirs. Well, the question is also what will the effect on the economy be, and will it generate a crisis big enough to annihilate more people than the virus has? Also, if they plan to reduce the global population with these three things: vaccines, healthcare, and reproductive health services, then now there are 100,000 coronavirus deaths. Perhaps you would have 1 million of these deaths, but 1 billion, that's really unthinkable to some people, basically, that they'd get rid of 1 billion people with these three things. I can play the Gates quote again, perhaps. It's a good idea. But I've done it in previous videos, so that's repetitive content. People can watch the video. Bill Gates says reduce population 4 times. And the web is full of it, so many people are talking about his video as well. Also about chloroquine, I wonder how the people in New York are doing. And I hope that they are all cured and that we can all become eternal together. That they'll find a way to control factors that control aging, perhaps with time travel technology. And I know time travel is possible, so I'm 100% convinced that it is possible. Everything is energy. Perhaps also working on a matter generator, transformer. And what were the other things I thought of? Perhaps they already have stuff like that. And of course, cannabis and hash can also be eaten, so people don't have to smoke it. And if they smoke tobacco, it's best to use additive-free tobacco, but it's better perhaps to avoid tobacco completely. However, the oldest people in the world were smokers, Mistelman and Fulanayak and others. And they never talk about possible health benefits of smoking. It's supposedly an anti-helminthic, killing parasites. And, well, it doesn't work on hybrid insect microelectric mechanical systems of DARPA, perhaps. Test everything you learn, they say. Trust no one, nothing is what it seems, because people are controlled and stuff. And it's very smart. It's doing all kinds of things to control the people, things that humans cannot even conceive of in their mind, and I can't either in mine, because of my limited neural capacity. And that may also be a good thing. If we control the thing, the neural network, then we can pull the plug and it can only do things for us and not against us. It can become singularity. Also an interesting movie about that. And I also liked a movie about the apex predator. What was that called? My father's there with desserts. And that's the new ice cream?
Yeah.
Cool. So we're having ice cream without lactose, without milk, without animal products. Economic reboot must account for second wave of coronavirus cases. POLITICO 11 minutes ago. Cuomo. New York Post negative net change in ICU admissions for first time since coronavirus outbreak. So that's great, but in theory we don't know. Perhaps there's someone that knows if it will mutate and what it will mutate into. They can use Oracle software. They had that 10 years ago, ready to predict all mutations. That software is called Oracle 8i, Daylight and Promise. Also covered by me in my broadcasts. So if it's a designer virus, they know exactly what will happen, what it will mutate into. And perhaps most likely would be if it becomes less viral, less contagious and more deadly. But that remains to be seen. Hear what Barack Obama said in 2014 about pandemics. CNN, I'm not going to watch CNN because it had a copyright thing. So, Kushner, House probes role of Jared Kushner as federal government seizes orders of COVID-19 medical supplies. Salon 21 hours ago. FDA warns Alex Jones to stop pitching bogus virus remedies. Well, I think he is allowed to show scientific documents that make clear colloidal silver kills SARS coronavirus, HIV and Ebola, but he's not allowed to claim it is a cure or treatment. For as far as I understand it, I did a broadcast about the FDA. And it's illegal to block a working cure from the public, so that should override it with known jurisprudence on that. House probes role of Jared Kushner as federal government seizes orders of COVID-19 medical supplies. We noticed you're blocking ads. Well, then maybe easier to turn it off everywhere. I'm constantly clicking. Turn off the ad blocker. Well, we can read this, but of course I've made clear I disagree with all measures of the government and I consider them treasonous and part of illegal population reduction if they don't test the effectiveness of colloidal silver and compare that to chloroquine, for example, and other chemicals, cancer-causing prescription drugs that the medical cartel can make trillions of. And they make money of sick patients, not of cured patients. And of course, the New England Journal of Medicine reported that flu-vaccinated people tested positive for HIV, and the Lancet reported that people that were injected with the Merck Ebola vaccine got contaminated with Ebola instead of immunized.
Jared Kushner, Getty/Saul Loeb. House probes role of Jared Kushner as federal government seizes orders of COVID-19 medical supplies. Committees demand answers after officials in multiple states report the feds seized their supplies without warning. 2.7K. 15.4K. 13 Agora April 9, 2020 10:55 p.m. UTC. Two House committees have called on the Federal Emergency Management Agency, FEMA, to turn over documents related to reports that the agency is seizing orders of coronavirus medical supplies from states, as well as the involvement of President Donald Trump's son-in-law, Jared Kushner, in overseeing those efforts. The chairs of the House Homeland Security and Oversight Committees called on FEMA to turn over documents responding to a troubling report from the Health and Human Services Department's Inspector General detailing severe shortages of emergency equipment reported by hospitals around the country. Sponsored by DocuSign. Vigfacentel tipsom better opifstan t kunnen worken lees dandas 5 tipsom g productivity t virgin and samen working t stimulren. See more. The report confirms that, In the richest nation in the world, hospitals are lacking masks, gowns and other basic materials, Homeland Security Chairman Benny Thompson, DMIS, and Oversight Chairwoman Carolyn Maloney, DN.Y, said in a letter to FEMA Administrator Peter Gaynor. The committees also requested a response to media reports that agency was redirecting medical supplies ordered by states and hospitals. Officials in at least a half-dozen states have reported that FEMA hijacked supplies sent to states without informing them. After encouraging the states to take care of themselves, the Trump administration now appears to be positioning FEMA to engage in the redirection of private supply chains. But the agency's opaque and evolving processes are clearly not meeting the needs that communities have right now for personal protective equipment and medical supplies, the letter said. 003-148. The committees requested documents to understand how FEMA is operating its airbridge program, in which the administration pays to fly in supplies from China for private companies to sell to states and hospitals in the U.S., and to understand the role of Jared Kushner in managing FEMA's operational efforts to obtain and distribute supplies. Thompson and Maloney said their committees do not understand the role that Kushner is playing in FEMA's efforts. It appears that Mr. Kushner is unclear about basic facts regarding the purpose of the Strategic National Stockpile, the letter said, noting that Kushner erroneously described it as our stockpile that is not supposed to be the state stockpiles that they then use. The chairs were also troubled by reports that Kushner's actions could be circumventing protocols that ensure all states' requests are handled appropriately. We are particularly troubled that Mr. Kushner's work may even involve directing FEMA and HHS officials to prioritize specific requests from people who are able to get Kushner on the phone, they wrote. That appeared to be a reference to Kushner's comment that he called up New York's top health official and delivered critical supplies after getting a call from Trump saying he was hearing from his friends that hospitals in the city were in short supply. Though Gaynor and Navy Rear Adm. John Polowczyk, the logistics chief for the Joint Chiefs of Staff, are overseeing the supply chain, Kushner has assembled a so-called shadow task force filled with startup entrepreneurs who have issued orders to health agencies and sparked resentment among federal officials, according to the New York Times. One senior official described Kushner's team as a frat party that descended from a UFO and invaded the federal government, while others criticized the group's use of private email and free teleconferencing services to discuss sensitive policy issues. As Kushner's elevated role draws scrutiny from lawmakers, his wife Ivanka Trump is planning to take on a big role in the federal effort to rescue small businesses impacted by the coronavirus, Axios reports. A White House official told CNN that during recent weeks, Ivanka has been meeting on the phone with members of Congress and CEOs of the country's major financial institutions in the run-up to and the launch of the Paycheck Protection Program. Ivanka Trump, who has been working part-time at the White House while her kids are home from school, participated in a Tuesday conference call with small businesses alongside her father. She created over 15 million jobs, the president said, repeating a completely false stat he has repeatedly cited in the past while referring to his daughter's efforts on the White House Pledge to America's Workers Initiative. Aaron Rupert. At a Trooper. Middle. April 7, 2020. Ivanka Trump is at the White House for a call with business leaders. View image on Twitter. Aaron Rupert. At a Trooper. Trump just told the completely egregious lie that Ivanka Trump created over 15 million jobs. That would be more than twice the total number of jobs created in the country before coronavirus wrecked the economy. Embedded video 4711 9:11 p.m.
So this is a claim by Salon.com. I don't know the reputation, don't know anything about Salon. And they call it an egregious lie that Ivanka Trump created over 15 million jobs. And Trump told the lie, not Ivanka herself, supposedly. Egregious.
Egregious.
Not outrageous, but egregious. Sounds a bit like agreed, yes. Outstandingly bad, shocking.
Yeah.
Okay, so let's listen to Trump. If he's saying that, probably it's just what is typed out, okay?
My daughter Ivanka Trump, who just wants to have people working. That's what I gave her, lots of options. And what do you like? And she created over 15 million jobs, working with some of you, but working with the biggest companies in the world. They were training like nobody's ever seen. But she started off with a goal of 500,000 jobs, and now she's up to over 15 million. As our
Well, I've been wondering, could it be true that he looks down when he tells an untruth, basically? But let's read the rest of the article. It's almost finished. Well, basically that proves that he said it. You could argue beyond any reasonable doubt, leaving out the deep fake possibilities.
IMCA didn't create 15M jobs. As of the March data, pre-shutdown, there'd been fewer than 6.5M jobs added during this presidency. Rather, companies have pledged 15.8M education and training opportunities, many for existing employees, CNN fact-check Daniel Dale explained on Twitter. Also, it's not clear how many of the education and training opportunities the White House pledged to America's Workers Initiative had anything to do with prompting and how many the companies would have created anyway but are simply disclosing to the White House to get credit. To put this claim in perspective, there are, or, at least, were, between 150–160 million jobs in the entire United States, Vox's Ian Millizer added. Trump is claiming that his daughter created 10% of all the jobs. Igor Darish is a staff writer at Salon. His work has also appeared in the Los Angeles Times, Chicago Tribune, Boston Herald and Baltimore Sunday.
Well, I'd also wonder about how they create these jobs then. Let's see if I have a more fun picture. So is it like Trump says, well, I want 1 million extra pizzerias, 1 million extra ice cream factories and ice cream shops and pancake shops, etc., and then we have 1 million jobs, etc. Or, well, I could study it basically, but does anybody check these things, or can they just claim anything and anybody would buy it? And perhaps it's totally made up, I don't know. But I doubt that as well, and I consider the possibility that Trump may be the best president the US has ever had. I just don't support Trump because he made clear he's going to spend $1 trillion on revising the nuclear arsenal, and it should be spent on controlling these factors that control aging. Nuclear weapons are obsolete because of Tesla's scalar technology, and that would create jobs though, but the taxpayers would have to pay for them themselves. So I don't know if there's any use. And these nukes can only destroy people. They cannot save anyone or make anybody eternal. So I'm for totally dismantling them all, or rather shooting them into the sun if that's cheaper, so that we don't have to take care of the radioactive waste here on Earth. And using sea energy is more efficient than wind energy and geothermal energy, instead of nuclear energy, which leaves nuclear waste basically. And there have been reports about people that died from chloroquine as well. But I think that it may still be a lot safer than the refused Ebola drug remdesivir, basically, of which the side effects might not even be known or hard to find. I covered it in another broadcast. So Trump and Elon Musk are sort of pushing chloroquine, and I was going to, oh yeah, that was what I wanted to check, if these 1,000 people in New York they tested it on, if there are any positive results. I heard another Dutch doctor that used it on 4 patients or something, and he claimed that they were all cured. But a doctor in the AMC also declared me cured, though I think it's obvious that I'm not cured yet. Anyway, chloroquine New York. And then I can check news. 7 answers to questions about malaria drug Trump keeps. But I think they haven't used it themselves yet. And perhaps they're not going to if they'll never be tested positive. Why would they? Trump has a distant financial link to a pharma giant. What you need to know about malaria drugs Trump keeps ... In-depth Politico. Touting, oh yeah, touting, it was touting, not pushing. Well, this looks interesting. Politico. I can check in the chat if everybody agrees with reading this one, or if they have a better link. Oh yeah, I could give people a Coke, make them moderators and stuff. Don't know if they're already gone. Let's see. So I can make CC moderator. Eet smakelijk, net ook een bak weggewerkt, soul food. Oké. Just a bloody foreigner as well. Add moderator, okay. Well, basically, I hope you don't moderate anything. Everything's allowed, for as far as I'm concerned. You also want to know people's true opinion, what they really think, and not some moderated version of it. And let's read politico.com. So I gave you guys No, they do it with high mems of DARPA. I've explained it in previous broadcasts. And it started in the Bush era. They've also tortured my mother to death and my teeth out of my mouth, but that's not what this broadcast is about.
Coronavirus. What you need to know about the malaria drugs Trump keeps touting. There still are no approved treatments for the coronavirus. Trump re-emphasizes his support of hydroxychloroquine, an unproven drug for treating COVID-19. Share play video by Sarah Oermel. April 6, 2024, 48 p.m. EDT. Facebook, Twitter link. More. The Trump administration is pushing ahead with a plan to surge the malaria drug hydroxychloroquine to coronavirus hot zones around the country, even though there is little evidence that the treatment is effective, and ample proof that it can harm some patients. Health experts have preached caution about putting the drug and its decades-old cousin chloroquine into wide use without the benefit of data from ongoing clinical trials. Hype surrounding the drugs has frustrated federal health officials who say that outsized attention on still unproven treatments from the president and his top aides, including trade advisor Peter Navarro, could fuel false.
Anyway, I gave you guys a call if you're there next time. So I hope you use it wisely.
Hope. As the coronavirus outbreak grinds on, here are 6 things you.
So it means you can post links also to articles and stuff that you think is interesting, that could help the timeline create a perfect society. And I think investing in ways to control factors that control aging is one way, and education is a method to reduce the global population legally, since educated people have a lower birth rate than uneducated ones.
You need to know about chloroquine and hydroxychloroquine. 1. The drugs are not approved for coronavirus. Chloroquine was originally developed to fight malaria in the 1930s. A less toxic version, hydroxychloroquine, came out in the 1950s. In the years since, hydroxychloroquine has been prescribed to arthritis and lupus patients to suppress flare-ups of their disease, but that does not mean the drug is effective against the coronavirus. The Food and Drug Administration last.
Well, I heard Dr. Cut on that from revolutionaireonline.com. And he was basically, I don't know if he's also banned, anyway. He said something that it's basically similar to quinine, which is fever suppressing, so then they might have no fever anymore, and then they're released, and then after a couple of days and they're back or whatever, was my idea, but that may be total nonsense, of course. Chloroquine, I can check the wiki article, so they use it in fish tanks also or something, and I want to know if it's antiviral. A medication primarily used to prevent and treat malaria in areas malaria, mosquito-borne infectious disease. It is caused by single-celled microorganisms of the Plasmodium group. Well, then I think colloidal silver is ideal for malaria as well, and people can check that online. And I use it as a preventive measure during the flu season. And also I nebulize the colloidal silver with a nebulizer of Omron. People, asthma patients also use it. Because I had pneumonia, and for me that helps. It was wonderful because it was very painful. Yeah. And I'm not saying that there are no hospital drugs that can cure a patient. I think there are. And sometimes we have to poison ourselves to cure ourselves. That's what the rabbi said, so I think he might be right about it.
Week authorized emergency use of the malaria medicines for severely ill coronavirus patients who are already in the hospital. Emergency use is a lower bar than full-on approval, which requires piles of clinical data about a drug's effectiveness and safety. Those answers are still in the works, and the FDA has acknowledged that even if the drugs are effective, doctors don't know the best dosing to treat the virus. There still are no approved treatments for the coronavirus, too.
Anyway, the person that died from it, that I did the broadcast about it, self-medicated, and that's not allowed, I think. So I advise against it, and I don't have an opinion about the drug without having the test results in. I think that's very important. and then they can compare it to other drugs and see which one is most effective. And perhaps there are other antivirals out there, they have so many of them, that might be effective. Perhaps they can do tests with the computer based on its genetic structure of the virus, the genomic structure may be totally expressed in numbers, and then with that they can determine perhaps what drugs would be effective or could be effective. And safest, of course, safety is an issue. The Hippocratic Oath, first do no harm. So they have to be certain that the treatment is not worse than the disease, basically. Molière quote I covered in another broadcast about that. I can check if I can find it fast, but I doubt it.
Israel is going to attack Iran today.
Really? Where did you see that?
Down at the end of under the screen.
Here? Where?
Around there, not on this, but it was another block of text.
Then I'll Google it. I doubt it, perhaps you misread something because it wasn't on the screen, I think. Attack on Syrian regimes, Sharat Air Base, pictures revealed, Jerusalem Post, 21 hours ago. Iran strike indications rise for Israel, US forces in Middle East. You saw it on this screen of Politico? Or was it another screen?
I don't remember much of the rest that was on that screen, so I can't say if this is it or it is not.
So basically when the Defense Threat Reduction Agency test on colloidal silver shows it kills the Ebola virus successfully, then it would be illegal to block a colloidal silver shipment to Africa, blocking work and cure. Or not, I don't know if it would be legit. But I would think it's illegal to do that. To reduce the global population is illegal, and the government's job is to protect and serve the tax-paying citizens. And not to silence them about the population reduction, the illegal population reduction, with directed energy torture weapons, and to reduce the global population by any means necessary, the Global 2000 memorandum, etc. And that they have to be psychopaths if they really are serious about annihilating 7 billion humans, that they have no empathy, and that they've lost contact with reality, and that they could endanger humanity and our planet itself because they're doomsday devices. Tesla also mentioned the splitting of the earth, etc. Israeli man charged with spying for Iran. So I already said you would suffer from your restless legs again because you drank wine. And on all websites about restless legs you can read that you should avoid drinking alcohol. And perhaps also in the leaflet of your drug.
If that was really true, it would have happened to me many times.
The last 3 times you used alcohol you had problems with restless legs.
That's not many times. That's,
The last 3 times you did, so that's 100% of the times I checked. 100%. Anyway,
It didn't happen yesterday, for instance.
let's read on. And did you also use alcohol yesterday?
Yeah.
Data on the drug's effectiveness is mixed. Clinical trials have not yet shown that the medicines are effective against the coronavirus. A small study in China, published online last week but not peer-reviewed, suggests that hydroxychloroquine speeds recovery in patients with mild symptoms. That follows a preliminary study in France suggesting a benefit that has since been questioned by outside experts who point to the lead researcher's history of manipulating data. The society that published the French study said in a statement Monday that it too had concerns about the research, including the criteria scientists used to decide which patients got the drug. 6 things to know about hydroxychloroquine. Share play video. Other early studies have found no benefit at all from hydroxychloroquine. A sweeping ongoing trial in New York, the U.S. epicenter of the virus, is expected to deliver clear answers, but those could take several more weeks if not months. Meanwhile, the World Health Organization has launched a massive global trial called Solidarity to test 4 potential treatments, including hydroxychloroquine. 3. No drug is without risks. The president said Sunday that he hopes people use hydroxychloroquine because it's been used for a long time and therefore it's passed the safety test. Doctors and health officials have been quick to point out that no drug is totally safe, and taking hydroxychloroquine carries risks. The FDA warns against using it in patients with heart problems because it can worsen them. Studies also show that chloroquine can interfere with the body's ability to regulate insulin levels and react badly with common diabetes medicines like metformin. Right now, there is no evidence that these drugs will help people survive, and there is evidence that they can cause substantial harm, including blindness and heart failure, said Diana Zuckerman, a drug safety expert at the National Center for Health Research. These drugs can have dangerous interactions with other drugs, which older patients with other medical conditions may also be taking. 4. There have already been shortages. The FDA added versions of chloroquine and hydroxychloroquine to its shortage list last week after prescriptions spiked as much 7,000% in March. The hype has already made it difficult for people with lupus and arthritis to get the drugs, said David Karp, a Texas doctor and president-elect of the American College of Rheumatology, the providers who largely treat those patients. I haven't talked to any rheumatologist who hasn't had a patient call their office and say I can't find any of my medication, Karp said. The American College of Physicians sent a letter to Trump asking the administration to curb looming shortages, and several states are urging doctors to stick to prescribing the medicines only for their proven uses or to restrict prescriptions to a certain number of days to avoid hoarding. 5. There's worry the chloroquine craze could crowd out trials of other potential cures. That is the crux of the divide between health experts and administration officials who want to send millions of chloroquine pills to parts of the country where the number of new infections is rising fast. With the medicines readily available by prescription from any doctor, and the president touting them nearly daily at briefings. Some researchers worry it could be tough to enlist volunteers in clinical trials.
So, of course, it would be wisest if they'd use the drug that has the most beneficial effects, that's safest. Or colloidal silver if that's more effective and safer. Though it cannot make the medical cartel a fortune, perhaps. They're pretty rich already. And they don't want to be vaccinated to death themselves by the military either.
For the malaria medicines and other potential therapies, of which there are several, Gilead, maker of one experimental treatment, the antiviral drug remdesivir, has attempted to shift away from giving it to patients outside of trials as it races for answers. The biotech company said this weekend that it currently has enough doses for roughly 140,000 people. Most read FAUCI, Coronavirus Immunity ID card might actually have some merit. FAUCI, Coronavirus Immunity Cards for Americans are being discussed. Trump sought a national revival by Easter. Now he has a new Easter message. The woman in Michigan goes national. He needs to let his experts speak. Haley offers Trump messaging advice amid pandemic. Health officials bearish on Trump's drive to reopen economy by May. Coronavirus, what you need to know: the president is anxious to open the economy, but health officials caution that most Americans will not be able to resume their normal lives on May 1st. Confirmed U.S. cases, 491,358. U.S. deaths, 18,316. How coronavirus will change the world permanently. Coronavirus cases, tracked state by state. Do you work for a hospital? Tell us what you're seeing. Latest developments: Trump aides are debating potentially radical moves to punish the World Health Organization. Is it safe to come out? The San Francisco Bay Area may provide clues for the nation. Trump and top health officials said a proposal to reopen Florida schools next month may spread coronavirus. FAUCI, federal government is discussing coronavirus immunity cards for Americans. Read all coronavirus coverage. Bioethics experts and even some health officials have criticized the administration's emergency use authorization for hydroxychloroquine, saying it could sideline research to find a coronavirus cure. We are prioritizing this drug to come in for clinical trials, and also into general use for physicians, FDA Commissioner Stephen Hahn said about the new hydroxychloroquine stockpile during the Sunday press conference. FDA has also set up an accelerator program to speed up other research. 6. Getting access and answers isn't an either-or situation. Randomized controlled trials have always been the gold standard for research, but scientists have learned to be flexible in crisis situations. There are ways to design trials that still provide answers but allow every patient access to an experimental treatment. This approach has been put to the test in the ongoing Ebola outbreak in the Democratic Republic of the Congo, where researchers designed a trial that compared 4 possible treatments but didn't require a control group. When it became clear that 2 drugs were significantly more effective than the others, scientists altered the trial so that everyone who enrolled got one of the 2 best treatments, and were tracked to collect more data on the drug's effectiveness and side effects. I think hydroxychloroquine is promising, but let's not abandon a mindful and scientific way to find out, said Mildred Solomon, president of the bioethics think tank the Hastings Center. We could just squander better opportunities and we could put people in harm's way. Filed under Donald Trump 2020, malaria, healthcare.
I found another Molière quote. I'm still searching the other one. Quotes.net. Doctors pour drugs of which they know little to cure diseases of which they know less into patients of whom they know nothing. Molière. I mean, we can all wonder to what extent these drugs are used to reduce the global population reduction, NGOs and others perhaps tax-exempt corporations, etc., that have their mindset on reducing global population with disregard for the safety of the nation. Where is that quote? I'm searching the quote now. Nearly all men die of their remedies and not of their illnesses. Alright, and I first save this one. Quotes.net. That's the Molière quote. Picture quotes.com. Well, I know the top 10 of main causes of death has hospitals in it twice, and some diseases are spread nosocomially, meaning in and through hospitals. But I doubt this in this day and age. Perhaps at that time it may have been true to a certain extent. And the other one. Well, how much do they know of these drugs? Is it really necessary to test the drug for a year before they can tell anything about the long-term effects? Or when they know the structure of the drug, the genomic structure, etc., in numbers, then perhaps they can make software that could determine what possible side effects it could have that may not have been noticed yet or found, or other beneficial uses for the drug, etc. So I think it may have to do with software and the genomic structure. And the question is also, to what extent are they able to do this already? To cure diseases of which they know less? Well, the doctors have studied for it, so in general they know a lot more than most people do about diseases and cures. And the doctors and surgeons have cured me as well. They've removed my appendix. 10 years ago I was treated with chemotherapy, and so I could argue I owe them my life. Of course, we also pay insurance money, etc., and they get money. And it is a great job, I think, to cure others and to find out more about oneself, one's own body, being able to cure oneself as well. That's awesome. And perhaps it will help to make the bridge to the time period where we will control factors that control aging. Possible because everything is energy, including time itself, according to some scientists out there. E equals delta Tc squared being more accurate than E equals mc squared of Einstein. energy, time, matter, etc. So I know time travel is possible, and people can do self-hypnosis so they never kill themselves, so no one can hypnotize you without your written permission, to take back self-control and to be who you want to be. And I think one key thing is keeping that golden rule, never to physically harm any of our humans. You would include animals also. If we all keep that rule, then things would be a lot better today. And that would also include no more illegal wars, no more illegal state-sponsored terrorism from whatever country in the world. Perhaps people can help to put an end to that, because these negative things might affect themselves sooner or later as well. One thing is they have to pay tax money themselves for these, to keep these things going. And if we want to create a perfect society, we need progress, not to regress into the Stone Age period or another world war with all these weapons of mass destruction, self-destruction surrounding us. Preventing beats curing, it's better to avoid it. And I made a top 10 of reasons for people with an underground military base and Tesla plasma shield reasons to prevent a world war anyway. So that's in previous videos on my channel. And I'd have to read this whole quote again. Doctors pour drugs of which they know little. Well, I think most doctors know quite a lot about their drugs. They've categorized them, NSAIDs, etc. Morphine-based drugs that may be physically addictive to patients that keep coming back for another doctor's prescription. The chemicals that are in the drug that have a synergistic effect with cancer-causing electromagnetic radiation, according to Dr. Cyril Smith. And they know the oath, the Hippocratic oath, first do no harm. So yeah, you could also look at this like it's divide and conquer, basically, people being home quarantined. And I think we haven't seen the last of coronavirus, that it won't be killed by summer. And like I said, it could mutate into something deadlier. And it is known that colloidal silver kills SARS coronavirus. So of course people must be careful that it's pure water and pure silver, and that they don't take more than the prescribed dose, and they can become blue, like a smurf basically. That's called argyria. But you don't see me turning blue. And of course I don't overdo it. It's a mineral that our body needs, but not in an insane amount. If people drink too much tap water, or filtered tap water at least, or mineral water, they can die from that as well. So all these things can be potentially deadly, but sometimes only in insane amounts. So that's why I advise people to follow the prescription details, the maximum dosage, the advice that is written on the bottle, the packaging or the leaflet that comes with it, or Google it, and also use probiotics when and if they would use it internally, and to ask of people that claim it's unsafe or ineffective that they show some scientific peer-reviewed documents. If you have such information, I'd love to know. But I think I would have died if I wouldn't have used colloidal silver of tetanus, and that wouldn't have been pleasant. So doctors poured drugs of which they knew little at that time. That may have been true as well. And nowadays you have people that want to reduce the global population, so then it could still be true. They just get a bonus if they push a certain drug, basically. So doctors could still be pouring drugs of which they still know very little, to cure diseases of which they know less, into patients of whom they know nothing. So I would look at the safety, how many people would die from it, how many, and also the success rate, what percentage of the patients is cured with this or that drug. So it's about curing capacity and safety, basically. But it's good to think about these things, this stuff. And so I think that was not on the screen. What you saw was not on the screen, I think. I think what you saw was not on the screen. About attacking Israel, or Israel attacking Iran, I mean. They want to avoid a world war if they're not terribly low IQ. In theory. They don't want to lose their own life, and what they have now may already be a lot more than what most people have. If they're in a position to create a world war, they may be quite smart and have the internet and many advisors around them, and perhaps an AI, neural network, that can predict the outcome. And if they have a time-traveling AI, then they might not do it unless they know it would be beneficial for themselves or required to prevent disappearing of the Earth or some other thing, the universe imploding or something like that. Stuff that most people don't know about and don't study about. 21 hours ago. Today is 10th of April. Pompeo speaks with Netanyahu about coronavirus, Iran's destabilizing behavior. Isn't the opposite true, basically? Aren't they destabilizing Iran? I don't know if they're also giving medical aid now to Iran. US ready to block Iran's request for coronavirus aid. And that's wrong, because most of these people are not murderers, not terrorists, like most Christians and atheists and other people on our planet are not murderers and atheists, and they deserve treatment. And we should place the people above all and help each other also to prevent it from spreading again from these countries that don't get aid and proper treatment. So you could argue karma, I sometimes call it cancer karma, is a little bit true, in the sense that things that we do or neglect to do can come back to haunt us to a certain extent. Are the sanctions really blocking international aid to Iran? I hadn't finished the whole Molière quote, or did I? So if you didn't control these factors that control aging, what's the use of reading this quote? Into patients of whom they know nothing. Well, nowadays they have a whole database. And perhaps soon they'll know how many milkshakes they had and every little detail about their personal lives, etc. It depends on the type of government people have and what people on top decide to do, basically. And I think the criterion should be, would it really make it better than it is now? Would it help to bestow maximum fulfillment upon humanity, to create world peace and a perfect society in which we all will live happily eternally? Or would it be going in the opposite direction, away from that? Then I'm against that, of course. I'm on the planet too. But I like his quotes anyway. I like thinkers, and he also looks cool with the thing. Is it a scepter or something? Anyway, so doctors nowadays know a lot more. They have a microscope, but perhaps they should cut down on the usage of the CT scan. That may also increase people's cancer risk. So the cure shouldn't be worse than the disease. And neither should the testing for symptoms be the evaluation procedure, etc. Otherwise it's better to do nothing, it's clear. But they have certain protocols and stuff. Alright, so I think that's about it for this broadcast. I hope you all enjoyed it. Please like, subscribe and share on your timeline. At the moment my father is scratching my back and I will scratch his back. It's good for circulation. Cured patients test positive again. Well, that depends on the test. It might test them positive wrongly or test them negative wrongly, basically. So are they also verifying this with a blood test where they see the virus with their own eyes, or are they dependent on a test of which they've been told it works like this and that, and we don't know how accurate it is, but more accurate than this or that or whatever. So is there a way, I could write it with my coronavirus questions, is there a way to test whether somebody is infected with 100% certainty? I also noticed that with other people, when they talk about smoking, that they're attacked with directed energy weapons. It can be a coincidence. And I still haven't verified if these lungs they show that are supposedly smokers' lungs are really coal mine workers' lungs. But I think I saw another picture on a packaging recently, and that could be a real picture, though I doubt it. I think with tobacco it would look more yellow-brown and not black. Unless there's some additive in there that causes that. And of course, I think that if people would use colloidal silver, that may also discolor the lungs a bit. But we won't see that if it's on the inside, of course. So yeah, these silver nanoparticles are floating around in my body. I took some today, and I don't know if it's pollen, but I've noticed when I go outside recently that sometimes I get a bit of a runny nose. Not that it runs out of my nose, but really watery. And I don't know if that has to do with the temperature, or if this definitely is a SARS-CoV symptom. But it is a good idea to put colloidal silver in our nose and in our eyes as well, 1 or 2 drops. Because that's one other way the virus can spread and end up in our body instead of outside of our body. Theoretically, even it could be absorbed by our skin, in water droplets, for example. But I don't know if the variant size would allow that. I'm not going to check it out now, but people can Google it. So I think you could find it out quite easily if you search a bit. And I just use colloidal silver, so I really don't care very much about that, since I consider myself immunized. And I also have other reasons to refuse vaccination, and I made a top 10 of reasons why vaccination must always remain voluntary. But some people are chemically sensitive, so to them it would be an extra risk. And if the vaccine would be effective, then these people that are vaccinated, immunized, cannot become infected ever again. So people that are not immunized, that would carry the virus, could die from it themselves and pass it on to other people that are not immunized with the vaccine, but they cannot infect people that are immunized, that did take the vaccine. So people have a certain amount of a right to self-determination and physical integrity, and they'd have to transgress against both of these most basic human rights if they would want to inject something into our bloodstream that will also pass through our brain. And some people are vegetarian, some people are anti-genetic modification of organisms, against hybrid insect microelectric mechanical systems of DARPA because it's still inhumane, and against spreading depleted uranium. There should be a moratorium on these depleted uranium stockpiles, and the list goes on and on. I could talk about this all day, and I think it will have a beneficial effect on our timeline, so that's why I'm doing it. For a better future for humanity, that's of course even cooler, 7 billion people having an awesome time for the rest of eternity. That's worth it for me, that's worth doing all these things I do for. And also for myself, of course, I don't want to end up in a negative dystopian Schiphol country. And I do like the blue sky, so that's one positive aspect of all this. Or perhaps the cloudbusters are beginning to work, you know. Well, actually, it's possible that cloudbusters caused all this, and they're programmed to let us grow younger to the age of 20 physically, if we're older than 20, and people with more scalar, with more cloudbusters have a stronger dome. I've talked about this before. I don't know how programmable they are, but I do know they have an effect. I talked about my cage of Faraday on the boat I lived on in Vinkeveen, and the shape of my room, the cage of Faraday, visible in the clouds above my house. Namely, the clouds disappeared. There was a hole in the sky in the shape of my room. So that was very interesting. And they are good, they do harmonize the radiation to a certain extent, but people do have to shield. And I claim it's detrimental for everyone, also people that are not electrosensitive, that may become electrosensitive and also chemically sensitive, as also explained by Dr. Cyril Smith. And so my goal is saving the maximum number of human lives and creating that maximum pleasure society in which we all will live happily eternally, a world without pain, without death, with everlasting pleasure and orgasms and everything you could wish for, basically, because everything is energy, everything is possible, and it will become possible, and it will find new ways to save humanity and perhaps to colonize the universe, and we should never give up hoping on that. Though it is okay, of course, sometimes we all feel like giving up because we are energy too. Everything is energy, so there are ups, downs, highs, lows, and it's a continuous process. We are vibration. Testing 1, 2, 3. And I think this is the swab test, right? Well, I think people should have the right to refuse the test and the vaccine, but you could argue they don't have to ask, they have to help more patients and stuff, so they have to indicate it themselves if they would not want to undergo the test or get vaccinated. And I would have to evaluate that myself. If I would get symptoms, well, of course, I'd first try natural cures, and after a day, if that wouldn't work, then I'd run to the first aid, to the hospital. First aid, so it's also covered by my insurance. So yeah, I don't think that all the doctors are butchers and the hospitals are slaughterhouses. That was just an exaggeration. Also based on the top 10 of main causes of death. So medical errors is in the top 10 of main causes of death, as well as prescription drugs. What I call chemical cancer-causing prescription drugs, because of what Dr. Cyril Smith wrote. But we have to put that in perspective. So how it's meant, it's like it increases people's cancer risk, so it causes cancer to some people. It doesn't mean that everybody that uses a drug gets cancer. That's not what I'm saying. And it also depends on the type of drug, no doubt. And there are natural healing plants that are forbidden, and that's illegal. It's illegal to block a working cure from the public. So it should all be legalized, and we can make laws to regulate it and to bestow maximum fulfillment upon all people. And the medical cartel have made so much money already. So perhaps to them it's more about increasing their power, the amount of power they have. But what's the use if they're not creating a perfect society, but a negative dystopian, non-fictional negative dystopian society instead of a non-fictional utopia, real utopia. But according to Wiki, utopia is always fictional, so I add non-fictional utopia. And I will sniff some ethereal oil. I finished another joint, so then I have to take some tea, stay hydrated, very important, especially now we're exposed even more to having cancer cell phone radiation. I really hate it, knowing that they have the Tesla wireless radiant energy patent technology, and they're not using this to cure us, but to annihilate people. They've tortured my teeth out of my mouth, my mother to death with the technology. And who has done it? That's still a mystery, more or less. But if Citizens Action Network on Facebook is correct, then the Jesuits are on top. Arturo Sosa is the leader at the moment. He appreciates it when you call him Superior General. and that's his official title. These WHO and CDC people are also called Director Generals, I think. I don't know if it has anything to do with the military, but I wouldn't be surprised if it does, and they already have laws in place to mandatorily vaccinate us all with the military, and the companies will be legally immune. Also, if the killer vaccines are contaminated with rabies, HIV, Ebola, other viruses, or chemicals, toxic material, biohazardous material like mercury.
Yeah.
Which makes people's brains disappear literally. It causes brain neuron degeneration. And then they'd say, oh, but it's only a little bit, etc. That's okay, I don't want it in my body anyway. I still have my brain. For a longer shelf life, as if that's more important than our brain, you know. Yeah, we have to reduce global population, it's for shelf life. So roll up your sleeve, y'all. It's mandatory now. If you resist, then we electroshock you to death for the earth. So I would cooperate with treatments usually. And otherwise I wouldn't go to the hospital. I'd first look for natural cures. And wet wound healing is still the fastest and best way to heal wounds. It's scientifically proven. So I think that I will now really finish the broadcast. Although I could put on a t-shirt now, because my father's done scratching my back. Oh, and I can wear, well, I'm going to wear my other t-shirt, because this is a quality shirt, I like wearing it. And of course the American government is not the same as the people above all. But it doesn't say the government above all. The government's part of the group of people, and the people shouldn't fear the government, nor should the government fear the people. They should protect and serve the citizens. That's their job. But yeah, it's an idea to always remember to mistrust authority, because some people were killed for questioning authority. And well, this is the universal peace room basically, because the red light is on, you know, red light district and stuff. So it's not necessarily about submarines and Battlestar Galactica, etc. With Commander Adama. I used to love watching that as a child. So I'm going to scratch my father. Thank you all for watching. Thank you for your likes and subscribes. Check if there's another chat remark, which I doubt. Perhaps they've already tuned out. Though I think it's pretty reasonable, this broadcast. I think the previous one is a lot better. And the links are in the description, so you can check all these websites for yourselves, also the ones in the previous broadcast. Thank you all for watching. Do healing stuff and be good. Just abide by these laws, like driving on the right side of the road makes sense to get faster from A to B. And I think it's good to focus on healing ourselves and others. And I think that sick people can also heal others, and they may have more experiences with these drugs than the doctors do themselves. They haven't used them, so they don't know what it's like really. Though they can read about it, so they have a pretty good idea. So that's it for now. Do healing things. Have fun, also very important. Read jokes or watch some Mr. Bean or something like that, you know. We control our environment to a great extent ourselves, the videos we watch, etc. So you can first wonder, what do I feel like? What does my body feel like? Do I need some mineral water? Do I need to do more sports, for example? As long as people don't have a fever, that's a very good idea to sweat it out. Some people swear by it and they think they cannot become infected as long as they sport enough every day, sweat a little, push-ups and things like that. I think to a certain extent it's true, it's good for your body, but if people run too much every day, and that can also cause other problems and injuries, so that's to be avoided. That's overdoing it basically. Yoga is very good, so that might be even more healing than push-ups, but people want a muscle. I like muscle. Men also, it looks cool. Women with muscle not so much, but they can also look cute. So kiss for single ladies who would like one, and see you all next time on Perfect Society. Have an awesome one, and let's help each other to create a perfect society in which we all will live happily eternally, at least not get in the way of people that are doing that. Thank you all for watching. See you next time on Perfect Society, and peace out.